Yes, so welcome to our, how many is this now? Maybe fifth conversation with Hastings Prince Edward Public Health. And we've got Andrew and Roberto here with us again. Roberto's upstairs, I'm in the basement. We've upgraded him to CEO status, I guess, or the upper level. So we can hear him well. And Andrew, you're joining us from away, I guess. You missed out on the muffins this morning. Anyway, so we're just waiting for a few more people to join us because we know it takes a little bit of time for people to kind of filter in. And we've got about 60 registered today. So obviously being in green is not easy, or maybe it's not easy being green, though it's what we've all wanted and we've hoped for. But there have been a few new things that have been introduced by the local health unit. So certainly I think we'll be looking for some questions around that or some answers and some descriptions or explanations. So with no further ado, I will probably hand it over to you, Roberto and Andrew, if you want to go ahead and take it away. Thank you. And thanks, Suzanne and Leslie and all the members from each of those chambers that have joined us.
Yes, well, thank you for that. And, we're very happy to be back once again, whether it's the fourth, fifth, or sixth time to help educate the chamber membership. And, we're in a good spot as of today, being that we're in a green zone status for the reopening framework. So we'll talk about a little bit about that and the safe transition from the enhanced lockdown and the stay-at-home order to the green status. And as always, I like to begin with a little bit of stats, so I'm going to bore you to death with some numbers, but just to get things placed in the right context. As of now, we have currently 11 active cases in Hastings, Prince Edward counties. That translates into a 6.5 weekly incidence rate, which keeps us under that threshold of yellow, which is 10 per 100,000. Our RO number is below 1, so for every case we have, that person is transmitting the virus to less than one person, which is great. That's one strong indicator. And for every case we have 6.5 high-risk contacts that we isolate until the 14-day period is over. Out of that, we have 14% of our cases we can't determine an epi link. So we have interviewed the case, but we're not sure 100% how the person contracted the virus. So that number goes up and down. I think last time we met, it was below 10. It might have been around 7 or 8, but it's spiked a little bit, and we're at 14% right now. Out of all the contacts that we identify, 98.8% of those are interviewed or contacted by the health unit within 48 hours, which is a very strong metric. So that once we hear of a case and we identify the high-risk contacts, within 2 days, we call those contacts to make sure that they're isolating and going for testing on the 5th day and also between the 10th and 12th day. In terms of vaccination, we've administered 1,483 doses of vaccine, and that translates to 99 individuals being fully vaccinated in our area, and we're following the ministry's priority list when it comes to who gets vaccinated in phase 1. So that's it for me for stats. Andrew, do you have anything else you wanted to add?
No, I think you covered most of the stats. Also comment that we have no one in ICU in our region or in the hospital connected with COVID. So all in all, we're doing really well. As everyone knows, compared to the province, we're doing really, really well in this region.
So, and I think in terms of being in the green zone, if I could just then jump over to the Section 22 order that came out, I think on February the 10th. Jill, I think, alluded to it in the introduction, or Suzanne. It was done in order to help us safely transition from enhanced lockdown and to the green zone. And what happened there is we looked at the higher risk activities in our area, and Dr. Oglaza issued the order based on that. And it was really targeting overnight accommodations, dine-in food services, and personal care settings. So individuals traveling from outside our area from an enhanced lockdown zone, a stay-at-home order zone, could not come and book overnight accommodation. They could come and have takeout if they chose, but they couldn't have dine-in, and they couldn't book an appointment at the hair salon or tattoo parlor or anything else that's considered personal care service. As time goes on, the ministry has taken more and more zones out of that enhanced lockdown. So right now, Toronto, York, Peel, and North Bay are the only 4 remaining in that status. So our order adapts to that. Originally, it was just us, Kingston and Renfrew that were considered green. Everybody else was in lockdown. So visitors from everywhere else in the province outside of Kingston and Renfrew were subject to the order. Now it's only visitors from Toronto, Peel, York, and North Bay. On February 22nd, we're expecting an announcement from the ministry, from the government, and those 4 zones may be changed. They might go into different status, and or the stay-at-home order may be lifted. So our order would only apply if we don't rescind the order. It would only apply to those remaining areas that are still in lockdown. Any questions and any comments, Andrew? I know you were more involved in drafting the order. Is there anything else that we should mention in regards to the order?
No, good summary there, Roberto. The main quick summary was that this was an attempt to discourage people from the worst affected zones coming to our zone when things were lifted. So we targeted those activities that we thought were most at risk for attracting people to come to our region. So there you have it.
And like we mentioned in past sessions, the operator has is legally authorized or okay or in solid legal ground to not take bookings from out of area if the person chooses to, or if the business. This order, I think, was meant to empower all operators to say, listen, there's an order by public health here. I'm not permitted to do so, for those who were not 100% sure they could do that legally on their own. So that's another reason I think that the order was passed, is to give the businesses and operators that empowerment. So in terms of the green zone, the details are contained in Regulation 36420. So during the lockdown, we were under a different regulation. It was 8220. Now it's 364. So we're reverting back to the regulation that was in place before Boxing Day. And it pretty much is the same, except for a couple tweaks. I think Jill or Suzanne mentioned that in the introduction. So if there's any questions on the contents of the green regulation, we can go over those. In a summary, some of the things that if we can remember going back before Boxing Day that were in place have been reinstated. So some of those include limits on organized public events have been restored to 1025 if they are held in a house or condo or a apartment building. In a business or organization, those limits are 50 and 100 again, like they were before Boxing Day. So an example of that, if a business organization wanted to have an AGM or a meeting, they can have one that's indoors that's up to 50 people, provided distancing can be maintained. The room is large enough to ensure that. If it's outdoors, as the weather gets warmer, that can be up to 100. Restaurants can resume dine-in service. There are some restrictions on that, like there were before. Tables have to be situated 2 meters apart to ensure that parties are distanced from each other. There's no buffet style allowed. The screening of patrons is required, but that's a passive screening. So signs on the door saying that if you are exhibiting any symptoms of COVID, or if you've traveled recently out of country, or if you've been in contact with a case or high risk or someone who's symptomatic, then you should not enter. And a safety plan should be drafted and made available upon request. Sports and recreational facilities are allowed to be open again. Retail is allowed to be reopened. One minor tweak in retail is for green zones is that you're required to have a safety plan and drafted and available upon request. We can make those templates available through Jill and Suzanne and Leslie. they're also on our website. And we have detailed ones that we've taken from the Workplace Safety and Prevention Services Agency that we can share with you. And screening of workers is still on across all sectors. For patrons, it has to be similar to restaurants. For retail, it should be passive in terms of posting signs. It's not until the orange zone that we, I think, see more active screening of patrons. And we're not sure exactly what that will look like when we get to orange, if we ever do, but we'll provide more details at that time. Personal care services are still are allowed to open again. Casinos, cinemas, performing arts. With personal care services, there is a requirement for personal protection equipment, which we align with the Ministry of Labor. So if the client is not wearing a mask to receive a service, then the staff person has to don a medical mask and a face shield or goggles. If the client is wearing a medical mask or a cloth mask or a face covering that affords source protection, then the staff person just has to wear a similar face covering or mask. So it's situational depending on the service, or if the person has an exemption not to wear a mask. I think that's kind of covers my summary. Andrew, anything else you wanted to add or highlight?
No, I think you covered it. Maybe clarify that source protection, we're always talking about, keeping it contained to you as the individual, and personal protection, PPE, is, preventing you from being infected. So just kind of definitions there. But otherwise, I think we're all set for questions.
Okay, there's one in the chat area, and it's a good question because I think you've touched on it, but maybe some clarity is needed. Do you have to maintain contact tracing for people entering the building, including staff? So this would kind of apply to your safety plan and maybe the type of environment you're in. So restaurants are required to keep lists of everybody entering the building. But then your staff should be screening daily. But a retail store can post that if you exhibit symptoms or signs, then you shouldn't enter. Is that kind of the deal?
So in the green zone, when it comes to restaurants, it's one person per party. Leave your name and number in case, let's say we find out a few days later that one of the staff persons is a case and they worked shifts during their period of communicability, then we would like to see the list of patrons. One person per party, that person would be contacted. We would get a more complete listing of who was at that table, and we will determine whether that person and their members of their party are high-risk contacts, i.e. if they were served by that particular case. So in the green zone, when it comes to restaurant, it's one person per party. As we move to different levels like yellow and orange, I think it becomes every person in the party to facilitate the job of public health. When it comes to personal care services, I think there's already in the regulation that was in existence prior to COVID requirements to capture that information for some facilities, not all. Correct me if I'm wrong, Andrew. But now it's also a requirement under the COVID regulations in the green zone.
Yeah, the standing regulation for personal service settings, regardless of COVID, was that they had to collect, at personal service settings, they had to collect contact information, except for haircuts. They were mainly concerned with the more invasive, riskier procedures.
Yeah, like tattoos or needling, which may have a higher risk associated with them when it comes to bloodborne pathogen transmission, like hepatitis B and so on, but not for haircuts.
I have a question that I had received ahead of time, if I can ask it now, because it's about the Section 22 order. And before we get too far away from that, in that order, it was saying that businesses, when certain businesses were not allowed to make bookings with people that was still under a stay-at-home order. And like you said, with so many more regions moving back into the framework this week, there's only 4 regions now that are under that stay-at-home order. And I know that I have some bed and breakfasts and smaller type accommodators. Just to be clear, they can put their own rules in place. So if they want to restrict anybody booking a room at their bed and breakfast or at their personal care salon or whatever, they can say that they can't be coming from a red zone or a gray zone, correct? Like they have that right to restrict it if they want to.
Yes, and this is something that came up, I think, in the fall, and we reached out to our own legal advice. Our legal counsel from the health unit responded that that is fine. We're not infringing on anybody's rights under the Charter of Rights, because that only deals with inter-province travel, someone going from Ontario to Manitoba or Ontario to Quebec. Within the province, a business can have that sort of rule, provided they're not administering it in a discriminatory way. So they're not excluding a particular group from bookings or a gender or someone with a different religious background. If it's being fairly administered, then that is legal. So we suspected that some operators were doing that when we were switching from lockdown to green, but we wanted to issue that order to try to increase that to as close to 100% as we could. Orders under the Health Protection Promotion Act, there's 2 types. One is a health hazard. If we come across a situation which is a health hazard, i.e., a premise that has a gross pest infestation, or if an owner is not controlling their dog, that sort of thing. There's another order which deals with communicable diseases, which in the past we've only used sparingly in the case of an active TB case that's not taking their daily therapy. We will issue an order to that person saying you're under a legal obligation to take your medication every day. Those are rare, but since COVID, Section 22 orders have been used more widely for different applications. North Bay had one during the lockdown, which prohibited or shut down their snowmobile trails. We had a lot of discussion internally about that because there was complaints up in Bancroft over that. A lot of people from out of town. We chose to apply one as we shifted from lockdown to green, just to make that transition as safe as possible. But to answer your question, yeah, the operator has that legal right to do that. So even after we rescind our order, whether it be next week or the week after, operators can continue that if they're doing it in a fair, non-discriminatory manner.
And if it's safe to say, that's really what your safety plan is about.
Yes.
So you can document how you're going to address people, how you're going to screen people, who you're going to let in, and whether or not you're going to accommodate people from out of town or not, and why. And as long as that's documented, then anybody who comes and would say, okay, I don't agree with you not letting me in, and say, well, it's part of our safety plan. This is how we keep our staff safe. This is how we protect our community.
Yes.
I think that safety plan, I think it's pretty safe to say that pretty well every business now should have a safety plan. I know it was adjusted in the new framework that retailers had to now have a safety plan in place. But I know as you go through the order and through the regulations, there's lots of references to that safety plan. And I know that you have a checklist available, so businesses can use that to go through it and identify the items that should be in their safety plan. And you also have a template available as well that I know we've shared out there with people. So, and I know when you guys did that blitz, I think it was in January, I think that was the #1 item that businesses were getting, was identified that businesses were missing, was that safety plan. And is it safe to say it can be a fairly simple document so long as it includes all the elements? Because I think there's some businesses that are feeling a little unsure about, about the safety plan, how detailed it has to be.
I can speak quickly to that. It's not an owner's document, really. It's basically writing down what you're already doing and follow the templates, kind of fill in the blanks. We're not asking for, there's not an expectation for a lot of work on this. it really is just summarizing what you're already doing. But as you commented about the blitz that we had, the compliance rate was low. It was less than 50%. And in response to that, the area public health inspectors will be out in the area following up on compliance in general related to COVID, and safety plans will certainly be one of the things I'll be looking for.
So get them done, everybody. Get them done.
Yes.
And you've actually posted them there are different safety plan templates for every different environment, correct?
I think there's lots of versions out there that, will provide you samples for, if you're a food premise or you're a personal service setting. But it's a basic same idea for all the places. But there's help out there. If you need to look online or look on our website, there's assistance available.
There's been a request to put some in a chat, so I'm going to go in and grab the templates off your website and put them in the chat while we're talking, so people can grab them if they don't have one already.
Oh, thanks, Suzanne. I was going to see if Lisa would do that. That's good. There are a few other questions sitting here, and I think there's a further to the order 22, the class 22. There was a question about being able to do that after February 22nd, and I think you've answered that from the perspective that it's still at the discretion of the business owner, and they still could say, and the people who are moving from more restrictive zones should not be moving into a non-restrictive zone. So there's still kind of this sense that you should be staying at home. But further to that, there's a question about the emergency break. So what does that mean for us in our region? And is a lockdown likely to happen the next day? How long would it be? Would it sit under 14 days? Any ideas on what that emergency break might look like for us?
As a health unit, we haven't received any official information from the provincial government. We know that they've mentioned that there's this option of applying the emergency break if, for example, the variants of concern lead to a sharp rise in cases. How that would be done in terms of process, we're not sure if it's by regulation or by Section 22 order, but the government has said that's available. And I think that's to allay people's concerns about the new variants that are circulating or starting to circulate. So even though case numbers have gone down across the province, we're under 1,000 mostly now in the last week or so overall across the board. There is a concern that the UK and the South Africa variant and the Brazil variant might lead to a sharp rise in cases. And I can't say for sure that we're going to have another lockdown. I guess I could reiterate what we've been saying in previous calls, is the more we follow the current set of rules and not try to cut corners, I think the better off we were positioned in terms of not having a spike of cases in our area.
There is a question on what guidelines for employers on what to do when a staff member calls in sick. I don't know, do you have a link to something like that, or is that more Ministry of Health, or Ministry of Labor type situations? Because there are resources available for businesses who don't have sick time or how they have to manage that. But maybe you could, if there is anything you guys have.
So we follow the provincial guidance on case management and contacts. We also, within the staff screening tool, there's directions. If a person answers any of the questions or fails the screen, that they're supposed to contact their healthcare provider or public health, and then we would give them directions. In the past, we've tried to flush out some of the more common scenarios that that you've sent to us, and we responded. Andrew and I contacted our case management leads, and we've given you some answers on that. So it's situational. If the person fails the screening, then they should get tested and then wait instructions from public health if they're positive.
Right. So calling in sick they have to be calling in sick because they've actually answered no to that screening survey, if it's going to be COVID related.
Yes, COVID related. I mean, people call in sick for different reasons. They could have a migraine, or they could have something else that they're experiencing that's not COVID related. If it is COVID related, if it's part of that screening tool, if they fail that, then there's further action to take place. Like in our own health organization, if someone calls in sick, their supervisor contacts that person and asks, were you experiencing symptoms related to COVID? If the answer is no, then there's no need for any further action. But if it's yes, then the person is supposed to get tested before they come back.
Right. And if you've ever gone,
sorry, go ahead.
no, I was going to say, if you've ever gone through the self-assessment online, it's pretty much you say yes to any one of those things and you should go get a test. So I guess if a staff member calls in and says, I feel like I'm experiencing a COVID symptom, then your direction to them would be go get tested and then follow the next steps.
Yeah.
Because if they do test positive, the health unit will get a hold of them and you guys will take care of it from there.
Yes.
I think it's important to note too, the Ontario government has just released an updated digital screening tool. I know originally we all had the paper forms that came out that you could use for either employees or for like other people entering your building. And then there was the digital tool that was introduced, and I noticed they've now enhanced it. So if you want your employees to actually self-assess self-assess before they come to work, they can actually do that through their phone, and now they can actually email the result to their supervisor. So if businesses wanted to get away from having staff filling in paper copies at the door as they're coming in, that's an enhanced tool that can be used for employees, and there's a separate one that can be used for customers and things like that as well, correct?
Yeah, do you have the link to that one handy? Because I did see that this morning.
I will. I'll throw it in the chat as well.
Perfect. Because yes, I stumbled upon it looking for another template and thought, oh, that's great. I mean, there were lots of businesses, or there were a few businesses taking advantage of the opportunity to sell you an app, but now we don't have to buy that with screening tools. Somebody had a question about the Quinte Mall and whether or not monitoring in and out at entrances, how do they measure capacity, or is it basically assessed at the store?
Great question. When we were in lockdown, there were specific, even though retail was closed, there were specific capacity limits for certain businesses, big box, grocery store, pharmacies. Now that we're in green, there is no ratio. There is no 50% or 75%. There's just a general clause that says that the operator is responsible for ensuring that the distancing can be maintained within the premise. So what does that mean in terms of each premise? I think it's situational. So if our inspection staff got a complaint, we would ask the operator what exactly they were doing and what the rationale was, but there is no hard number right now when it comes to retail establishments. If we move further up to yellow, orange, or red, then I think those ratios kick back in. But right now in green, it's a generic clause in terms of ensuring distancing.
So yeah, I think the most questions have been about this that I've received from businesses. So long as they can visually, if they go around their retail store and they can see that customers are easily able and their employees are able to maintain that 2 meter distance, then they would be within the guideline. It's just that, if the store starts to get too crowded, then they're going to need to, maybe restrict access, but they don't actually have to work out a formula. It's just making sure that people can easily move around their premises without getting too close to each other. Is that right?
Yes, and the other item within retail is that fitting rooms, every second one should be not used at this time. So that back-to-back fitting rooms are not permitted. And as well, if someone is lining up outside are congregating outside the business, then the operator is supposed to ensure that 2-meter distance in the lineup is being adhered to, and face coverings. So if a premise has determined that X number is their limit, and they've held people outside until someone else comes out, then they're supposed to ensure that the lineup is done in a safe manner.
And I'm going to assume that also applies to if there should be a couple of people waiting to pay at a cash register, the store should continue to ensure that there's markings on the floor to make sure that anybody waiting to cash out is not getting too close to another person.
Yes, and we've got a couple complaints about that recently, where there's a dedicated lineup within a store for a cashier, but they've also introduced automated checkout counters. So that we've been trying to work with operators in terms of ensuring that even though some people are being pulled out of the line to use the self checkout. So you're correct on that. Yes.
I would like to address the B&B question of the minimum info that is to be reported on clients that stay at a B&B.
I can't see anything specific to Airbnb, but I think as we're in green, it would be recommended phone number and name of the one person per party. Have you seen anything related to Airbnbs, Andrew?
No, that's all I had written down for contact information. As long as we have a name and a phone number, we considered that contact information.
Yeah.
And do you have anything at all yet on a standard for goggles and shields? And so personal care services, home care, do they require a mask as well as the goggle shield? I know that was an implemented thing in the restaurants in the yellow zone with the whole shield piece. Personal care at home, is that still part of it?
Yes, as I mentioned earlier, if the customer is coming in and has a mask exemption, so they have to receive their haircut or other personal service without a mask, what we traditionally recommend is that those individuals be scheduled at the end of the shift. But notwithstanding that, the provider should be wearing a medical grade mask and an eye protection, so a face shield and goggles. There is a link on Health Canada, I think, to personal protective equipment that we can send you that has more details about the various types, so that you can circulate that to your members as well. And going back to the actual scenario, if the customer is wearing a face covering or a mask that, as Andrew mentioned before, doesn't offer source protection, so it's a very flimsy gaiter that they just pull over their mouth, and it's not over their face, and it doesn't fit tightly over the nose, the mouth, and chin, then that PPE requirement for the provider would also be triggered, and that's something that the Ministry of Labor, we're aligned with the Ministry of Labor.
Can you clarify, Roberto, if a winery tasting room is considered a restaurant and able to open within the green area?
In green, they would be, yes.
Yeah.
Provided that they're complying with our Section 22 order.
Thanks.
And there was a question at the top here about travel, and I know we talked about this on the last webinar as well. When on the dashboard, when you attribute a case to travel, does that mean out of the country, or could that just be travel even outside of the Hastings Prince Edward region? What is the minimal distance that someone has to go before that's attributed to travel?
That's changed over time. Originally, I think it was out of country, but now it's out of our health unit catchment area. So we've had a couple of cases where someone has traveled to southwestern Ontario or northeastern Ontario and acquired the virus from someone they were visiting. So those people would be designated as a travel case. It was acquired through travel.
Or acquired outside our region, basically.
Yeah. So if they went to North Bay or Thunder Bay or Sault Ste. Marie and they picked up the virus there from someone who's a known case, we would designate or tag that as travel.
Because I think the big thing is we want to understand what our community transmission rate is. So when we start seeing a spike in cases because you went to the grocery store or you went to a restaurant or whatever, that's when we start kind of having to change even our own methods of protocol or understanding whether or not our safety protocol is working here properly. But if somebody goes outside the region, they've already put themselves at that risk, is kind of what I take from that anyway.
Yeah, there's risks associated with travel, especially if you're going to an area that's much higher prevalence. Like I mentioned, our weekly incidence rate is 6.5 cases per 100,000. Some of the other health units, their weekly incidence is 150 per 100,000. So a magnitude of 10, 20 times more higher incidence. And with the new variants as well, exposure, I haven't read up too much on the updated case management, but one of the outbreaks in Peel that's happened in a condo building, the public health people there think that it was mostly through elevator transmission, even though people were wearing masks. So that goes back to the question of the break. These variants, if they do take off, there's a potential for that break to be applied. In this particular case, public health, through their investigation, it was just people sharing an elevator going up and down 4 or 5 floors to the lobby, and they contracted the virus from someone.
Yeah, I think that's a great way for, I've heard from some of my members, one in particular that submitted some questions in advance about the province reopening and the concern of that before the vaccine rollout, and with so many variants out there and spreading quite quickly. There's a question of why the province is reopening because of this information. Having to restrict visitors and restrict the kind of clients they have is really not a viable model for us, is the submitted question. So the opening and the closing and the reopening again is really hard on businesses financially. So I think we're just looking for some clarification in this question on why the province is reopening with so many unknowns and without a vaccine established and rolling out in our local region right now very, very quickly when we have such a senior population.
I'll let Andrew address that one.
Yeah, thanks. That's an excellent question. I actually saw a very interesting little blurb on TV about, I think it was maybe the Globe Mail interviewer asking one of the main doctors on the panel saying, this doesn't make sense. Why are we opening up when we've got the variants of concern looming in the background here? And there, basically, the reporter says, am I missing something here? And the doctor basically responded, no, you're not missing anything. They've made the decision to go ahead as they've done and open things up. Because COVID is one thing, but there are other factors. The businesses, as everyone here is well aware, are hurting, and being open even for a bit now could be a saving grace for some of them. And there's mental health issues. People feel, the longer this goes on, the more problems we're going to have. There's issues that kids should be in school. So there's no clear-cut answer here. It's just weighing the pros and cons and the balance of issues at this point. They figured this was the way to go.
Yeah, like I've said before, we don't envy the job of the provincial government because they have, they have many bodies or sources of information. So you have the public health people and you have the business community, and they have to sort of juggle both interests. And it's interesting as well, even within the public health community, there's varying views on that. As you might have seen in the media recently, the medical officers for Peel and Toronto want their lockdown extended, but right next door in York, Dr. Kurji is encouraging that theirs not be extended, that they be moved into the red zone. So it's a very tough position to be in as a government, to take all that information and input from various sectors and come up with a decision or solution that is to benefit the entire province. So when we were in lockdown, I mean, our case numbers were very low, and in the green zone. So a lot of people were questioning, how do you justify us being in lockdown when our numbers are low? Whereas other people saying, we need to stay this way a little bit longer so that cases from transmission from other areas don't come here. So it's a very difficult position for the government to be in, and even public health agencies. So I don't envy the government.
I think what I look back to is how many people we had here during the summer, and the numbers, especially in the county. But we didn't, at least from my recollection, there were really no cases of transmission for those tourist experiences, or we didn't see an uptake in our local community getting more COVID or seeing more case test positive as a result of that activity. So it suggested that the safety protocol in place was working. So if businesses keep their safety protocol up to date, and I'm just thinking, you're talking about a variant and people getting it in an elevator. Well, have people stopped washing their hands now because they're wearing masks? So if we have, we keep the sanitization, we keep the social distancing, we're very lucky that we can manage the distance piece here. We're not dealing with that density. So
yeah, I would wonder though if those people, yeah, you're absolutely right, and I don't disagree with you. And there was not a lot of local transmission, and our numbers remained controlled. But the people that were coming, were they then going home and getting tested in their public health region, and it would be associated with their addresses there, and not necessarily with our region during the summer season, right? Like for how it's tracked, I don't know, but
no, I would say they probably did have it. The point is that the protocol here was in place and it kept people safe.
Yep, and it's working in our schools as well, for sure. I don't disagree with you. I'm just the things I'm hearing from my members as well.
Yeah, I'd just like to go back to another question that's in the chat. And I know compliance is a big issue for a lot of businesses, and they don't want to break the rules. And this question is just wants to verify that if they have their employees either sign in at the door or do digital screening every day, and if they have their safety plan in place, and this is a small, an office type setting, would they be compliant? Those would be the two things that they would need to have done. Should they be comfortable in knowing that if an inspector came to their door and their employees were being screening, they had, everything else in place and a safety plan, should they be compliant?
Yeah, well, for the most part, I mean, if all the things in the regulation are being addressed, then yeah, they would be compliant. Even if there's some gaps, we would work with the operator to fix those things that weren't correct at the time. What happened during the Blitz? Initially we started planning that with the Ministry of Labor before Christmas, and then it continued on in January. And it was mostly to be an educational type of exercise, but then the government started talking more strongly about laying charges. So we did have some charges during the Blitz that perhaps we weren't envisioning. But when it comes to inspection and enforcement outside of Blitz per se, whether it's our staff or the Ministry of Labor, issuing fines is not our first step. We educate, we then move to warnings and then charges, but education is a large part of that. So if a business wants to reach out to us and ask, am I doing everything correctly, we will engage in education with them. If we get a complaint about a business, we will do the same. It's only when there's continued non-compliance that we move on to warnings and charges.
So businesses should see inspectors and the staff at Hastings Prince Edward Public Health as partners and helping them make sure that they're doing everything right. So There is another question too around places of worship. They're asking if they have to be at 30% building capacity. Is that something for the green zone, or is that correct?
Yes, for funeral, weddings, and religious ceremonies indoors, 30% of the capacity. So that is usually an exercise where the church contacts the municipality, finds out what their occupancy is for their building, and then takes the 30% number from that, provided that people can distance within that space. If it's an outdoor wedding or funeral or religious ceremony, it's up to 100 people.
And even if we go back to that other question about being compliant, there are two situations here. So there's the one situation where a business is concerned about being compliant because they don't want the health unit to come in and tell them that they've done something wrong and get a fine. The other part of that compliance is, are you keeping your staff safe? And that's that Ministry of Labor piece, that if you aren't doing things and your staff feel at risk, then that's where a whole other series of things come up. On the other side of that, the health unit typically, with the exception of maybe this retail blitz, in what condition or situation do you go and visit a business?
Well, we have our standard, well, pre-COVID, we had our mandated, we inspect, depending on the premises, we had a certain frequency, a number of inspections per year. Truthfully, in COVID times, we're relying, inspections are more driven by complaints. So if we're getting, a lot of complaints about a specific premise, they're not enforcing the capacity limits, or too many people aren't wearing masks, then that's, we'll do a site visit.
Okay. So it's unlikely for a business that's doing the screening at the door, controlling the PPE inside, and doing all of the things that we've been directed to do, it's unlikely that they're going to get a visit from you just randomly.
Up until now, yes, but now we've just kind of opened it up a bit where we're, since cases are relatively low in our region right now, we pulled back some of our inspectors that were doing case and contact management work, following up on positive cases or high-risk contacts. And we're now pulling them back into doing regular inspection duty. So you might, I think you should expect to see the inspectors out a little more now than they have been recently.
Okay. So have your safety plan ready.
Yes. There's a couple more questions in the chat. I think we'll try and get to them before we finish up. One of them is regarding lineups outside of businesses. If the business has got signage up there and markings on the sidewalk, what other responsibility does the owner have to supervise behaviors outside their business?
Well,
Again,
go ahead. Go ahead.
Oh, no, you first.
All right. I was going to say, it goes back to the concept of due diligence, right? So due diligence is a sliding scale. It's a legal term, but really it comes down to, is the operator taking or doing all the reasonable things based on the situation? So you start off with putting signs up and markings on the floor, and you get compliance, so everything's fine. But if things start going awry and the health unit gets complaints and we investigate, and we see that the markings are there and the signs are there, the inspector will talk about, what else can be done that's reasonable under the circumstances, based on the fact that the markings and the signs are not necessarily doing the job. So it's situational. But really, for the most part, we haven't really received too many complaints about lineups. In wave one, we were getting a few of those, but now that the regulations are clear, then I think there's better compliance. We were also getting what I called weird complaints, people thinking that you can't smoke in line outdoors, which was not, it's a recommended thing that you don't expose others to secondhand smoke, but there wasn't a regulation, there still isn't. Even though the operator can say, you're on my property, don't smoke, but don't expect the health unit to enforce that if it's not in the books. So it's situational when it comes to lineups, outside retail and food premises.
That's good. And then the other one that we have in the Q&A is asking if a business owner can be penalized or charged if they do serve customers from a stay-at-home region.
Yes, under the Section 22 order, I explained the whole history of when we used to order, use Section 22 in the past when it came to tuberculosis and all that. And in the past, we weren't able to issue tickets. Since November of this year, the province has given us the authority to issue a $750 ticket for non-compliance with the Section 22 order. And they also extended that to the police and bylaw. So when we passed our latest Section 22 order, we forward that information as a reminder to police forces in our area, the OPP detachments and Belleville Police, so that their frontline staff were aware of that. We haven't heard of any instances where warnings or tickets or educations interactions were done with operators, but there is that authority there. They can start with a $750 ticket.
And I see there's lots of, we actually have quite a few manufacturers on the call today, and I know, they did have some questions earlier around some of the masking of employees. So, and there's another one being asked about, they do serve customers. I think it's a hearing aid company that's asking the question. They have masks on and gloves. So when they are serving their customers, so long as their customers are wearing a mask, they do not have to wear the goggles and shield, correct? But if their customer has to take off their mask and they're going to be that close, they would have to then put on further PPE.
Correct.
Okay. And then for the manufacturers and other employers, so if your employees are working in an area, whether it's a private office or a workstation that's distanced from other employees, and they're not in an area where they're going to be dealing with the general public, then they do not have to wear a mask while they're working at that station. But if they were to be going into a common area or going to be dealing with anybody from the general public, walking through the halls of the building, then they should be wearing a mask.
Yes, and that's in 36420 as well. And in the Occupational Health and Safety Act, that's the approach that the Ministry of Labor inspection staff are taking. However, that applies to, the entire time that the employee is in the building. So we speak with the Ministry of Labor inspection staff on a regular basis, and there have been instances where they're in a manufacturing plant and employees are going in and out for their break and they are taking their mask off too early and they're passing close to people. So it applies to the space at all times, not when they're just at their workstation, if they're in a production line, for example. So they have cautioned employers and spoken with individual employees under those circumstances.
And I know you had identified, I think it was on the last call that we did in January, you had identified that break rooms and lunch rooms and places like that were suspected of being places that could easily transmit the virus between employees. And I know you had some extra posters and other materials to help employers ensure that those lunch rooms where people were eating and having something to drink were safe.
Yes, and based on our experience with some outbreaks we had, but also other things from other health units that we've heard about, the lunchroom or going outside for a break and perhaps sitting next to each other in a semi-sheltered situation has led to transmission. And the province has as well picked up on that, and they've had their own ads. I think I've seen screenshots of billboards in the GTA where they've said, the harmless break can actually do some harm. So they've picked up on that, and they've tried to educate the employers and workers across the province.
That's good. I guess, I know we're coming to an end, and I just want to squeeze one last question in before Jill starts to wrap things up. I know that we're in the green zone, and my understanding is as the other communities are moving from the province-wide shutdown back into the framework, everyone will move in for at least 2 weeks into that current situation, and then that every 2 weeks it'll get assessed as to whether or not they move up or move down the framework. So, how is the assessment happening for us? We're green, and I'm hoping, I think everybody else is, that we're going to stay green. But how often is that going to be assessed? Is it a weekly thing, a bi-weekly thing? And what are you looking at when you're making that decision?
So prior to Christmas time, our medical officer of health was meeting with provincial representatives from Dr. Williams' office and talking about our current indicators. And then that information would be looked at by the ministry on a Thursday, I believe, and an announcement was usually made on a Friday via media release. I'm assuming that process is taking place now as well. Right now we're at 6.5 cases per 100,000, for example, and it's Thursday, so I think we're going to stay in green for at least another week. And if the incidence rate stays low between now and next Wednesday, then we would stay in green another week. I'm assuming that's still the process. The Toronto, Peel, and York and North Bay situation is, I think, in a different time cycle. They're coming up on the 22nd, with, I think, is Tuesday, if I remember correctly. So they're being dealt differently. But health units like us, like Haliburton right now, is in orange. Peterborough, I think, is yellow. Kingston is green. I'm assuming that we're all being looked at on a weekly cycle like we were before Christmas.
So keep up the good work, everybody.
I was just going to say, they also look at the hospital capacity in the region as one of the factors that they consider. And we're doing good in that.
Anything else you want to add? And then I think we've answered all the questions that were there. That was great. You guys did a great job this time. So anything else you want to add?
I feel like I've talked too much, so I'll let Andrew finish off. He usually has pretty good nuggets of wisdom.
I've got nothing outside of, apparently we did well this time, which implies we didn't do so well the other time. So good to see that we're improving as we go along. And we look forward to the next session.
Okay, no, not at all. I think it's more that the questions, here we are 5 times in, and people are getting a little more familiar with what the requirements are. And so the questions are still really good ones, but we're getting fewer. I mean, certainly the communication is working, and having you available to us is really helpful. So thank you for sure for coming.
Thank you.
Anytime.
And to everyone on the call, thank you for joining us once again. And if you have any other questions, feel free to send them either to Suzanne, Leslie, or myself, depending on who you know best. And we're happy to extend them, pass them on to Roberto and Andrew, who have now become our very close friends. Okay, thanks everyone. Okay, thanks guys.